First of all, let me say that we have started a bit late, but we're going to finish on time. I'm going to turn this microphone over to Mark McClellan at, is it 11:29, Mark, or 11:39? 11:39. At 11:39. It's as Father Fahey indicated, I'm controlling less and less the older I get, but I am capable of controlling time, so I'll pass this back over at 11:39. The whole topic here, and you guys, the two of you will know a lot more about this. Both Senator Wyden and Congressman McCrery were on our National Commission. And as I said in my opening remarks, among the things we attempted to do with that commission was get people who actually have stake in the game when it comes to politics, because they're much more likely to be able to say, this is what we think can get done. And we had as well Haley Barbour and Phil Bredesen, two elected governors. It's the first time, actually, that elected members of Congress and two governors were in the same room discussing this issue. And my strong belief is in this particular area, that's something that's going to have to be, we're going to have to create an opportunity for the governors and the members of Congress to come together. Otherwise, we simply aren't going to solve the problem. Let me tackle, Congressman and Senator, one particular problem. There's a question earlier about the workforce that I don't think we've adequately delved into, and I personally think it's one of the areas where you can see the nature of the problem pretty clearly, and I think there's a possibility, from my own knowledge of politics, there's a possibility that Republicans and Democrats could come together and again use that as a foundation perhaps to build out. The numbers are this. Over the next 10 or so years, you're going to see about a 40% increase in the number of people over the age of 85. The problem is the number of people from 25 to 40, which are the largest number of primary caregivers, whether it's a CNA or a licensed professional nurse or an RN, there's providing the bulk of the care. The number of people from 25 to 40 isn't going to increase at all. Well, somebody's got to provide that care. And if you go out and the Commission heard this over and over and over, that what's missing is a clear career path where the feds have come in a comprehensive way and said, here's what we're going to do with graduate medical education, increase the number of gerontologists. Here's what we're going to do to increase the opportunity for the states to build real career paths in this space. And I'm just curious from you, I know both of you had a fair amount of experience in economic development and working with local groups to try to increase the kind of job training that's occurring in a variety of areas. And I'm just, if you could address the possibility in the area of the workforce for congressional action, because I do think in that one area we're looking at a real short-term problem of considerable magnitude that doesn't appear to be getting smaller, it appears to be getting larger.
It's easy to describe the problem, and the problem is nationwide. I don't think it's restricted to urban areas or rural areas or the East Coast or the West Coast. It's all over. I'm from Louisiana, and we have an acute shortage of caregivers really across the spectrum of health care, but particularly in the area of long-term care, and it's something that we have grappled with as policymakers. And unfortunately, after receiving lots of testimony over a number of years, we have yet to come up with a proposal that makes sense from both the standpoint of being sufficient incentive to get people into that line of work and something that's affordable. And that's usually where we end up with a wide range of health care proposals, is the affordability from the taxpayer standpoint. Do we want to, as a federal government, get so involved in the financing of health care that we end up with a single payer system basically covering every facet of health care paid for totally through the tax system? And that's a perfectly legitimate response to our problems, and there are many who advocate that. Most of us still don't advocate that and are searching for ways to avert ending up at that spot. But I'm afraid so far, at least in my experience, we have not come up with a very good way to address the shortage of caregivers, particularly in this area. Now, Ron and his legislation and others have proposed answers to further financing long-term care and trying to get more private financing into long-term care, which I think is the right approach. But as part of that, clearly we've got to find a way to entice more people who are looking for work to be trained, educated, and employed in that line. And I don't know right now. Maybe Ron has some more ideas about how we do that, but every idea we get, it seems, is very, very expensive, and Congress just kind of backs up when faced with that level of cost.
Bob Kerrey and Jim McCrery are two of the best and the most knowledgeable, and let me just see if I can kind of flesh out their comments. We have been tackling the workforce issue in the context of the Healthy Americans Act. This is the legislation that Senator Bennett and I have. We have 8 Democrats on it as co-sponsors, 8 Republicans as co-sponsors. So this is the first time in the history of the United States Senate when there has been a substantial number of senators of both parties on the legislation. And I think when you get into the workforce issue, and Bob Kerry's done some very good work with Newt Gingrich on the long-term care part of it, you ought to think about it in the context of what Jim McCrery's talking about, which is the workforce needs in healthcare generally. You look, for example, at what has come out of Massachusetts in the last few months. It's very clear that one of the great challenges there is to have enough people in the primary care field. They have not had all the providers they would have liked, and that has been a great challenge for them. We're rooting for their success. I think they're almost a mirror of some of the challenges for our country. With respect to the workforce, one of the areas I've been particularly interested in is essentially seeing if it would be possible to reconfigure some of the job training programs that are now funded by the federal government to put a sharper new focus in the healthcare field, both in terms of long-term care and primary care, the challenge that you see in Massachusetts. And one of the things that's striking about going that route is it might well do a great deal to help with this economic challenge we're facing in our country. Because if you look at the job training dollars today, you get the sense that certainly a portion of that money is being spent to train people for positions that are going to be outsourced in a few years. One of the areas we have an opportunity to address in long-term care and primary care is you train people for healthcare jobs. They're going to be able to get good wages, and those are jobs that they can do here in the United States. So right now, as part of this exercise of fleshing out some of the provisions in the long-term care section of the Healthy Americans Act, we've got a private provision, a public side. We are looking at workforce issues with the specific objective to try to see if you can wring more value out of the federal job training programs, get them to focus more on the healthcare areas where there are good jobs that you can do here in the United States, both in long-term care and as it relates to other parts of the health profession that we're going to need people for if you're going to add all these new people in the system, as we're trying to do and others are trying to do in the Congress.
Well, let me just add one thing that I didn't think of in my initial response, and that is there are proposals that have been made by some to encourage more family members to get involved in the care of their elder family members and giving them some kind of financial incentive to do that, perhaps through the tax code. And that could be part of the answer to filling this gap in the workforce.
Yeah, just one suggestion, then I'll ask a question about what you think the climate's going to be in the Congress when you all come back. What is it now, the 109th? Whenever you all come back in January. One suggestion is, particularly you, Senator Wyden, who will be here still in the Senate, is that when it comes to long-term care, the governors are critical, and they meet annually in February. I know from conversations both with Governor Bredesen and Governor Barber and the National Governors Association through the commission work that you were all involved with, there's a great deal of enthusiasm to participate with the Congress in trying to solve this workforce challenge, because the numbers are just so compelling, and I appreciate very much that it's not an easy problem to solve, but this is one that it seems to me it's likely that you could get some pretty good bipartisan support for whatever the solution is, just because you have so much community support for the idea that something needs to be done. So just talk to us a bit about what you think the landscape's going to look like. What are the chances for reform in long-term care and health care in 2009?
I'm very encouraged about the debate, and in particular, I think, and I look around the audience, I see a lot of people who've been involved in health care reform for a lot of years, and the story of health care reform is almost the story of unrequited love, that you've been at it for years and years, and you think, gosh, maybe this is the time, and you find something that's exciting to you.
It actually feels more like Christy Brinken's trial.
I think I'm gonna steer clear of that and the debate with the Rodriguezes, because that's filling up the tabloids. But the point is, we've all seen again and again these efforts go by the boards, the last time, of course, being 1993 and 1994, the Clinton years. I will tell you, this time we've got two dramatic developments that I think bode well for the future. The first is, there's never been a bill in the history of the Senate where we've had a substantial bipartisan effort for universal coverage. That's number one. Number two, we got a very favorable analysis from the Congressional Budget Office that said that the effort was largely revenue neutral a couple of years in, and the third year would actually, because you're changing the incentives that drive behavior, would actually start generating some surplus. We never had that as well. And finally, and possibly the most important, I see something of an ideological truce, and it's something that Jim and I have talked a lot about, and that is that Democrats have made the case that to fix the system, you've got to cover everybody. If you don't cover everybody, the people who are uninsured shift their bills to the insured. So Democrats have made that case. Republicans, Jim and others, have made, in my view, a very logical case that you really have to have a significant role for the private sector in terms of choices, making sure you don't freeze innovation. You need to fix a dysfunctional marketplace. So the opportunity next Congress is to meld together Democratic ideals of covering everybody with some of the principles Republicans have had about a role for markets, not freezing, innovation, making sure that they're private sector choices. Now, on long-term care, and this is why I want to congratulate Bob Kerrey and Mark, I just think all of us have got to make sure that long-term care is not the afterthought in this debate, that it's not the forgotten stepchild. And there's a lot of history of that happening in this debate. A lot of people who remember 1993 and 1994, and Bob and Jim were around, is all the focus in 93 and 94 was on cost. And nobody talked, for example, about quality, and nobody talked about some of the bureaucracy. And what we ought to do, and that's what's valuable about this program, is making sure that long-term care is not the afterthought, not the forgotten stepchild in the debate. And as far as I'm concerned, as a member of the Finance Committee, we've got some provisions in the Healthy Americans Act. I have some other ideas I'd like to bounce off some of you in the course of our 20 minutes or so. But Bob Kerrey and Newt Gingrich have given us some very sensible recommendations, and we're going to use that as sort of a framework for where we ought to be going.
Jim, what's the House look like?
Well, I think there's actually more consensus and willingness in the Congress to do big things like Social Security, Medicare, long-term care. We've had, as Ron said, it's been a long courtship with these big ideas, but we've actually come fairly close in the 20 years that I've been in Congress. I mean, back in the Clinton years, we were that close to doing Social Security reform when something happened in the White House and kind of distracted the president, and he had to do other things. And then early in the Bush administration, Mark McClellan and Bobby Jindal and I and Nancy Johnson and others were working very hard on a weekly basis trying to develop a comprehensive Medicare proposal. And then 9/11 happened, and the president was distracted, and obviously efforts went to other into other ways. But we've come close several times in the 20 years I've been here to actually putting something on the table and having the ability and the willingness to move it. So I think there's actually more willingness and consensus that something has to be done than is apparent. Obviously, all of the elected members of the House and Senate are concerned about the political ramifications of getting out front because both parties have, through the years, used these issues one way or the other to scare people and to move votes at election time. And so there is always that apprehension. But all it's going to take is leadership. I'm convinced that if we had strong leaders on both sides of the aisle, on both sides of the Capitol, that would work with people like Ron, who are willing to force the issue by getting good ideas out there, I think we can get something done. I won't be here, so I'll be from the outside looking in, but based on my 20 years experience and working with people like Ron, I think it can happen. Most of us, I think, know it's got to happen. We can't just keep everything on autopilot because we'll crash.
Well, let me ask as a follow on that, Jim, to both of you, what advice would you give either Senator Obama or Senator McCain to include in their first State of the Union address that might advance the cause of long-term care reform and health care reform in a way that would produce improvement in both? What would you advise them to say in their State of the Union address, other than endorsing Healthy Americans?
Yeah, right. The new president is the only person of our 300 million flock in the country who will have a mandate, who will actually have a mandate for the public. So I'm sure they're going to have their own bill. What we have said in the Healthy Americans Act is we're going to work very closely with the new president. Obviously, we Democrats passionately support Senator Obama. The Republicans just as passionately support Senator McCain. The captain of our health care team in the United States Senate is Senator Kennedy, who has fought passionately and in an extraordinarily committed fashion. And what I see us doing is pulling together legislation that they can pick up on, that a new president and the leadership in the Congress, working with those of us on the committees, can pick up on. What I think the next president can say directly to the American people, they're going to be tough choices. We're going to have to make them together. I'm not going to be interested in finger pointing. I'm going to try to rally the country on the key kinds of questions, which is to make sure that we rein in the costs. Part of that, in my view, is to change some of the incentives that distort the health care system. And in particular, as now the Congressional Budget Office has shown, it's possible to get quality, affordable coverage to all Americans without breaking the bank, without busting the budget. And I think for the next president to talk about this in the context of the economic insecurity people are feeling, and that if we come together and resolve it, we can address that, would be the message that I'd want to convey. I mean, the fact of the matter is, the reason people don't have greater take-home pay is that everything goes to health care costs. And then, after they have their smaller take-home paycheck, the rest of it goes to gasoline. So that's where your money goes. And the next president can outline that there are choices that we can make together that give us a chance, particularly in health care, to resolve something that we've wrestled with for more than 60 years. And while we don't know who the next president is going to be, we know for certain that the next president is going to be a United States senator. And in the United States Senate, there are a whole bunch of people on both sides of the aisle who want to work with that new president.
Well, I would just add that the most important thing for the next president to say in his State of the Union address with respect to these issues, Social Security, Medicare, Medicaid, long-term care, health care, is it has been proven that the solutions to these problems lie with neither political party. Both political parties have to be involved in coming up with a solution to these problems. It can't be done on a partisan basis. As president, I will work with both parties to bring them together around common sense solutions that we can all embrace to move this country forward on these issues. Whoever the next president is, has to make that perfectly clear, that he does not want to solve these problems working with his own party. He's got to solve them working with both parties. So that's the most important thing, in my opinion, he can say.
Before we take questions from the audience, let me, Senator Wyden, Congressman McCrery, ask you if there's anything, just sort of, since you didn't get an opening statement, anything that you'd like to say to address the audience?
It's always ominous if you let senators make opening statements, and I'm going to spare you that. There are a couple of other areas that I think would be very promising in the long-term care area that we picked up on along the way that we would welcome your ideas and suggestions on. One of them is the role of technology as it relates to long-term care. What's been striking is that seniors are now coming back and saying a lot of these websites and a lot of the tech products are all made for young people. It said what we'd like are things like cell phones and websites and the like that are really senior friendly and would like to be a tool essentially in long-term care. So for those of you in businesses and related fields who have new ideas for how to use technology to better meet the long-term care needs of the older population, that'd be very helpful. The other area that I'm interested in stems from an initiative that is now coming out of the Center for Medicare and Medicaid Services, Kelly Weems. You may know that they have set up a rating system for long-term care. And this comes from the fact that I and others have said it's really possible to get more information about washing machines than it is about the quality of long-term care facilities. And I think there's a great opportunity for people who are interested in this field to help us get more information out that is facility-specific about the quality of long-term care facilities. One suggestion we made to the Center of Medicare and Medicaid Services is a lot of the advocates say that they're going to be using outdated data. They're going to be using data that no longer is particularly valid. So in those two areas, technology and consumer information so that families can make choices, those are areas we'll be looking at in the Healthy Americans Act, and we'd welcome your input.
Jim?
Well, just very briefly, I'd like to list some of the ideas that are floating around out there as to how to address the long-term care situation. One thing Ron touched on is CMS has been tasked by the Deficit Reduction Act to undertake a 3-year study on the costs and quality and outcomes of long-term care across the spectrum of sites delivering long-term care, and that should provide us some useful data. Some have suggested that we move toward a Medicare payment system that is based upon the care a patient needs and not the care a patient chooses, which would be an interesting endeavor. But that data should help at least show us the parameters of that discussion. Education is clearly important, and there's a number of proposals to increase the educational campaign to inform not only seniors but their children as to the importance of long-term care and preparing for the eventuality, in most cases, of long-term care of one sort or another. So educational efforts are important and should be part of an overall program. Lots of proposals to expand home and community-based Medicaid waivers. Ron has an excellent one in his legislation. We already talked a little bit about providing tax incentives for caregivers. And, of course, for years we've talked about giving a tax incentive for the purchase of long-term care insurance, private insurance. Right now, the only way you can get a deduction for that is if you have over 7.5% of gross income going to health care, and not many people have that. So lots of talk about expanding the incentives through the tax code to purchase private long-term care insurance. Reverse mortgages, obviously something that is being talked about a lot nowadays and could be used in the context of financing private long-term care. And then along the lines of Ron's bill, these Medicaid long-term care partnerships with the states, I think, provide a lot of promise in putting together the private financing and public financing of long-term care. So those are some of the ideas that are floating around out there.
Questions from the audience? Yes, sir.
I'm John Green. John Green with the National Association of Health Underwriters. We've talked a little bit about the Only-Owned Future, education, outreach in the States, but that's the funding for that is going to go away soon. So I was wondering if it might be feasible if we had a postage stamp where we paid a little extra for, and that extra money could go to be a dedicated funding source to keep that program going, because it's really working in the States.
All of those ideas that are voluntary clearly have a lot of attractiveness. One of the areas, and we'll miss Jim in this debate because he's been such a thoughtful person in talking about these issues, is the question of how do you generate new revenue in a way that is acceptable to the American people. In other words, essentially it becomes palatable and you don't have everybody marching in the streets. You'll recall one of the health bills, Dan Rostenkowski was chairman of the Ways and Means Committee, and everybody was banging on his cars. So you've got to find a way to address, particularly in long-term care, where there are going to be some additional needs for funds. In the Healthy Americans Act, we've shown that a basic package, we believe, can be done for the amount of money that's being spent today. But long-term care, I think, will take some additional revenue. I'm studying these various proposals for retirement savings where you make it easier to have people contribute. You've probably seen a number of companies have voluntarily said, we're going to take it out of people's paycheck, and then they have to tell us they're objecting. I'm not sure we're ready for that, but any ideas like yours where there are opportunities for people to voluntarily make contributions, particularly for long-term care, that will generate some new revenue, you're going to get, huge waves of support in the Senate on both sides of the aisle.
I promised 11:39. It's 11:39. Mark McClellan, it's back to you.
I want to particularly thank Senator Kerrey, Senator Wyden, and Congressman McCrery for a very stimulating discussion to top off this morning's panels, and I am particularly appreciative of all of the fundamental challenges that have been discussed today, whether it's on quality of care, financing. All of it took place and all of it stayed on time, so that gives me some confidence that we're actually going to be able to do something about it, building on the optimism and the opportunity for change that people talked about here today. There were a number of ideas discussed that kept coming up from a lot of different perspectives and with a lot of support. Ideas like making available consistent and accurate information on the quality and cost of long-term care services regardless of setting, measures that can be used confidently as a new basis for payment, a new basis for regulation, a new basis for improving care. Ideas about giving individuals and families more awareness and more support for taking control of the care that they're receiving, support for caregiver networks in that regard as well. All of this kind of information, this financing and regulatory reform can promote a well-supported workforce that does what needs to be done in delivering the diverse range of long-term care services that we're going to need in the months and years ahead. And finally, we heard about a lot of concrete steps to address the long-term fiscal sustainability problems through better use of public dollars and getting more private dollars into the system. And as you heard today, it may not be as hard as some have thought. Meaningful steps to enhance the availability and participation in long-term care insurance, ideas like reverse mortgages that you just heard about, all these things can help make progress on challenges that may not be quite as big as we thought. So I want to again thank all of our panelists, Bob Kerrey, Newt Gingrich, and all of the staff who are involved in putting this together, Elaine, who did a great job holding up the time limit signs to some people who might seem a little bit imposing, Justin, Teresa, everyone who's been involved in this, in the preparation for this event and making this possible. Also want to emphasize that we will be taking some further steps based on this meeting, given how much opportunity there seems to be for private-public collaboration and alliance for progress. We're going to be holding a series of meetings starting in late August with many of you who are here today to turn the existing efforts and clear ideas for progress into actual progress over the months ahead and heading into the 2009 legislative session. But most of all, I want to thank all of you who have shown interest, who have shown involvement, and who have shown leadership to get to high-quality, efficient, up-to-date, long-term care services. We must be part of the solution to addressing these problems, and you all have done a lot to make that happen. Thank you very much for joining us today.